I was 2 years old when I first developed having asthma, and it's been really chronic throughout my whole life. I had 2 knee replacements, I had prostate cancer, and just a realm of different health issues are just bringing me down, where it was hard to function, hard to live. As I like to say, I was going around the drain, ready to go.
We invested so much money in the Human Genome Project to unravel literally the blueprint of our species, and what it showed us is that while there's so much in common that we have, there's also all of this variation that occurs between people.
I think the biggest challenge for the American healthcare system right now is we have an education model that teaches us to manage disease. So that education of disease management, now put into a system of seeing as many patients as possible, has left us with all I can do as a doctor in that system is prescribe a medication or refer to a specialist.
The world has switched into a digital world. The technology has really exceeded what we even imagined even just 50 years ago. I mean, who knew that in the palm of my hand I would have access to all the world's information, and I can access anybody in the world right now, literally in the palm of my hand. Medicine hasn't really shifted from what it was 200 years ago. There's still the doctor, the patient visit, there's prescription of medicine, consultations, and in order to get access, we have to be where the patients are. So what is integrative medicine? Well, integrative medicine is exactly what it sounds like. We want to integrate all the tools that we know as physicians and also integrate other players in the game to really help our patients thrive. We want to know, are we able to reverse some of these diseases? Because what really matters for our patients is their quality of life, not just their longevity.
Fullscript is a technology platform that allows practitioners to create their treatment plans and deliver those individualized treatment plans to their patients. By creating treatment plans based on the core principles of integrative medicine, nutrition, mindfulness, and movement, while also being able to prescribe healthcare's best supplements, Fullscript has been a powerful tool for my practice and many other integrative practitioners. Practitioners can learn more about integrative medicine from a variety of different sources. Fullscript alone has created the educational content to help guide practitioners to understand this health-promoting care better, as well as understand the evidence base behind making the recommendations that are so key to patients' health.
Patients really do appreciate this. They don't have to go out and look for it. They don't have to call the doctor's office to see if it's in stock. So it takes pressure off the practitioner's office staff, and it also allows the patient to be in control and follow their treatment plan more effectively. You know, one of the most precious things we have in medicine is the relationship between the physician or provider and the patient. You know, this is where the magic happens, that connection. Patients often feel better when they leave the office before you've actually even done anything, right? I can't tell you how often that happens. But this is also a challenge for us, and one of the problems that we have with the modern system is there is not enough time.
And so that's why we use Fullscript. We use Fullscript as a platform to turn numbers into words, into actions, so we can be proactive and develop that relationship between the doctors and the patients.
That partnership between the patient and the provider, those care partners where we're both working towards the same end, is so powerful and so sacred. It's one worth investing our time and energy in. And you know, in medical school, training our physicians not just to be good at biology and chemistry, but good at communication, good at listening, good at compassion, to keep that compassionate heart. I think this is what will keep physicians engaged in medicine, and it will lead for a richer experience for the patient. Integrative medicine is the medicine of the future.
That's the kind of doctors we need in the world today. I think they all should be those kind of doctors. You're there not for a paycheck, but you're there to make people well. You're there to help people live longer. And a doctor should see every patient as being like his only patient, and I gotta help this person.
Fullscript is inspired to continue to lead integrative medicine into the future because patients deserve better. Health should be preventative, and that should be the focus over prescription. Fullscript wants to focus on the evidence behind leading this charge in the core principles of health: mindfulness, movement, nutrition, and appropriate supplementation. And with the platform that we've built and the growing number of practitioners coming into this field, we hope to change medicine for the better.
Through my doctor, through Fullscript, and all the help that they've given me, and bring me back to where I should be, I congratulate them. And I thank you. Thank you.